Okay, our last three speakers, I'm going to introduce them all at once. They are critical partners in this fight, and let me ask them to just all come up here. The first is our doctors, the Physicians for a National Health Program. Very excited to have Dr. Adam Gaffney here to share his experiences as a practicing physician. Also want to invite up the incredible Public Citizen. Public Citizen has been at the forefront of the fight for decades on this issue. From day one, they have been leading the charge and taking on industry giants who are ready to attack this movement. Please welcome Robert Weissman from Public Citizen. And last but not least, I'd like to invite up my good friend Jennifer Epps Addison from the Center for Popular Democracy to share words about what CPD is doing, but also her own personal experiences with healthcare and why we have a dire need for Medicare for all. All right, Adam.
Thank you. So I am so happy to be here today speaking as a representative of Physicians for a National Health Program, an educational and advocacy organization of physicians across the country who know firsthand that a single-payer Medicare for all system is what this country needs.
That's right.
I'd like to thank Congresswoman Pramila Jayapal for the leadership on this, and everyone here who's joining together at for this critical cause at this crucial moment. So I'll just say briefly, as physicians, we see daily the harm that a for-profit, fragmented, privatized healthcare system imposes on our patients. We see the uninsured, the 29 million people without any health coverage, who go untreated, who develop unnecessary complications, who even die as a consequence. We see the underinsured, the 44 million people who have coverage but with holes and gaps so big it's as if they're not covered at all. These are people who go without needed care, people with asthma who don't take their inhalers because they can't afford the prescription. People with heart disease who don't fill the prescription at all because they can't afford it. People with multiple sclerosis, mental illness, cancer, who can't get the care they need because the copays and the deductibles are too high. And then meanwhile, as physicians, we are encumbered with never-ending billing tasks and administrative tasks that take us from the bedside, that take us from the patient, from the practice of medicine itself. We see a corporate calculus replacing the fundamental calling of the medical profession and the profit motive superseding medical science and justice. No longer. A Medicare for all system would guarantee health care for everyone in America, replacing the current welter of fragmented, inadequate plans that deny claims with a universal coverage that is not only comprehensive, but first dollar. Not only portable, but seamless over life. That allows you to see the doctors and go to the hospitals that you want, not the ones that your insurance company tells you have to go to.
That's right.
At the same time, such a system would allow us as physicians to again focus on the care of patients, away from billing and back to the bedside, which is why we became doctors to begin with. Thank you so much, everyone, for joining together. The time for half measures is over. Medicare for all, a single-payer universal healthcare system is the name of the game, and we're gonna win it. Thank you.